Good afternoon. How are you, Nicholas?
Good. How are you?
I'm good. Thank you for asking. Do you remember me from yesterday? No. That's okay. That's okay. You've seen a lot of people between then and now. Okay, I'm Terry, and I do introduce myself to my patients by my first name. I'm going to be your PTA again today, so we're going to work together on some bed mobility and maybe sitting on the edge of the bed a little bit. What do you think?
Okay.
You ready?
Yeah.
Sweet. All right. So now I'm going to raise this up because I know I'm not going to be on this for 2 seconds. All right. Going up in the world. All right. What we're going to do again today is practice scooting up and down and side to side. And then we'll roll after we scoot. But I want you to be able to reposition yourself first and take some pressure off of different body parts. So scooting will help you with that.
Okay.
All right? Are you okay with me raising this pillow up a little bit?
Yeah.
Okay. You put your head back down. Okay. That feel all right? Okay. So when we do segmental scooting, that means we're moving one part of the body at a time, which is different than log rolling, right? We want to teach all of our patients to log roll. That means to move their body as a unit, protecting that back. But when they shift side to side particularly, it's okay to do segmental movements, okay? So the first thing I want to do is to have you scoot toward your right side. So you're going to move your head over a little bit first, and then I want you to push through your elbows. Do you remember doing that yesterday? Okay, so we're going to just say general weakness, maybe recovering from Guillain-Barré, recovering from a significant illness, but this patient has use of both upper and lower extremities for practice purposes. Okay, now what I want you to do is I want you to try to shift your shoulders to the right. So push through those elbows. There you go, perfect. Now we're going to bend up these legs. I'll help if you need me. Good. And now I'm going to come under the lumbosacral area, that joint, L5-S1. I'm going to come right under there, and I'm going to come under his ischial tubes. If he needs me, I'm going to come under here if he needs me. I'm not going to do it if he doesn't need me. Okay. Now I want you to push down into your feet and lift your bottom and scoot your bottom to the right. Excellent. Excellent. And he didn't need me. And now reposition your legs to the right. That'll work too. Okay.
Did you want me to do this?
Yes.
Oh.
Okay, so you're back in midline.
Yes.
Okay. You actually moved them into midline when you straightened them out. So that's why I said, well, okay, I'm all right with that. But we don't want their legs to be askew to the left. We want them back in midline. Okay. So good job. That was pretty easy, wasn't it? Now let's go from the bottom up. So you're going to move your feet first to the left. Good. And now you didn't need me a whole lot going to the right. But I'm going to put this hand under here just in case you need me. Okay? And push through your feet. And nice. And now we're going to come up here, same thing. I'm going to come under your shoulders. You're going to push through your elbows and move your shoulders. Good. If you have the head control to bring it with you, not all patients will.
Okay.
But yes, if you have the head control, he was asking, do I leave my head there or bring it back? If they have the control, bring it with the shoulders. But if they don't, then they can do that segmentally. Okay? Nice job. You ready to roll?